Every generation of doctors has faced the exact same problem. There is simply no way for us to hold in our brain every research article, every treatment algorithm, every clinical guideline, and every update ready for immediate use, especially in the middle of a busy patient clinic or when we're treating an acutely ill patient. So what if I told you that a recent AI app just scored 100%, a perfect score on the US medical licensing examination? More importantly, about 1 in 3 medical providers are currently using this app for day-to-day treatment of their patients. Of course, we're talking about OpenEvidence, the ChatGPT for doctors. But on this channel, we don't buy into the hype. We're going to look at the pros and cons of this app and see if it allows us to treat our patients better and potentially practice smarter, not harder. So let's go. Hey everyone, I'm Dr. AJ Balram. I'm a full-time practicing physician and surgeon. Welcome to SpeakMD. If you're new here, my goal is pretty simple. I evaluate the tools and technologies that are shaping modern medicine. We're at a massive inflection point in modern medicine currently. AI is entering the exam room, and we, physicians, not tech vendors or administrators, should be the ones that decide where it fits into patient care. Today, we're going to do a deep dive on OpenEvidence. First, we're going to look at the historical context of where medical knowledge comes from. Then we're going to dive into the app and see how it differs. Finally, we're going to run the app through our 4-question SpeakMD framework. Number 1, does it work? Number 2, will I get paid? Number 3, will I get sued? And number 4, how does it fit into my practice? Let's get into it. To understand why OpenEvidence matters, we have to look at how we got here. Of course, medicine initially started with a transfer of information from physician to physician in an apprenticeship model. We still do that today with medical students and residents. Then the information became so voluminous that we transferred into the textbook era. Huge, large volume, dusty textbooks that, if you think about it, are kind of outdated the second they're written, but they are still an important part of the fundamental learning associated with medicine. Then came the journal era. We moved from scarcity of information to abundance of information. I mean, how many clinical journals do you have stacked up in your office right now that you haven't even touched? Now, it's pretty difficult to stay up to date with the information associated with the journal era because a new study is published to PubMed every 30 seconds. There's no way a human can read all that. We went from starving for data to drowning in it. More recently, we entered the up-to-date era. It became the gold standard for referencing up-to-date clinical information. Almost every hospital had access to it, and doctors were using it for quick references. The reason up-to-date was great was because, yes, it collated all those important research articles, but it also had experts that were reviewing the articles and adding their commentary. So at least we had some sort of human element to ensure that we were following the right guidelines. Now we're starting to enter the AI assistant era. So what is OpenEvidence? Well, you can think of it as a merging of ChatGPT and PubMed. You don't necessarily ask for specific keywords like heart failure guidelines. You ask it specific clinical questions like, what is the first-line treatment for patients with low ejection fraction, heart failure, and low blood pressure? It then synthesizes that information and then responds to your question. Let's go through a quick example so that I can show you how it works. Okay, so now we're in the OpenEvidence app, and I'm going to ask a somewhat controversial clinical question. What is the current diagnostic criteria for necrotizing fasciitis? This is a good way to assess how OpenEvidence is going to respond to a question that doesn't have an exact answer. You can see that it brings up a New England Journal of Medicine article that is an overview of necrotizing fasciitis. It is very helpful. It gives citations for every article that it considers in its response, and then also gives a very helpful diagnostic algorithm that a clinician can follow. So now let's try something a little bit more controversial. How do you determine what journals to include in your answers? This is where OpenEvidence throws up a roadblock. It says that they use reputable journals, but doesn't really give you any information about their secret sauce of how they determine their answers. If you ask any probing questions as to how OpenEvidence works, you get this same roadblock. Finally, we're just going to look at the rest of the app. There are different portions of the app, including a social feed with new articles, a ambient AI scribe that you can use to document patient clinical encounters, as well as a dialer that you can use to call patients. There's no doubt that the OpenEvidence app has taken the medical community by storm. It's estimated that about 40% of physicians are using the app for day-to-day care of their patients. OpenEvidence's goal is to get this to greater than 50% in the next 1 to 2 years. Their latest claim to fame was the 100% score, the perfect score on the U.S. medical licensing examination, after the questions were fed into the app and responded to by the app. And the company itself is exploding from a valuation standpoint. They just raised at a $6 billion valuation, backed by some of the biggest venture capital firms out there, including Google Ventures, Sequoia Capital, and Kleiner Perkins. As a side note, here's a question. Have any of you medical students, residents, doctors, PhDs, graduate students, whose blood, sweat, and tears were put into researching, writing, submitting, and getting these articles published, essentially all the articles that generate the value proposition of this entire app, have any of you guys seen any of that $6 billion valuation? If you have, let me know. That's a topic for a totally different video. I digress. Let's dive into the SpeakMD 4-question framework. So let's start with number 1, does it work? Well, yes, OpenEvidence works excellently. It synthesizes a ton of information and responds to your clinical question in a way that's helpful. The accuracy is surprisingly good because it's grounded in medical literature. What OpenEvidence does is it partners with reputable journals to ensure that the information that it responds to you in the app is peer-reviewed and researched appropriately. It essentially has curated a high-quality medical database for doctors to query. I do these videos because it's a good diversion from the day-to-day hustle and bustle of medicine, but it does help to see that when I see some new subscribers, at least the content that I'm making is resonating with folks. So I appreciate you subscribing if you like the content. So, question 2, will I get paid? Well, there's no CPT code for AI-assisted diagnosis and treatment plan, so it's not an app that's necessarily going to increase your revenue, but it's a time saver. It's an efficiency consideration. If it allows you to see more patients, if it decreases the need for you to go look up journal articles and allows you more time to get home to see your family, that's definitely worth it from my standpoint. When we talk about money and these apps, we also have to talk about how much it costs. In this situation, OpenEvidence is free for all physicians to use. Actually, anybody with an NPI number can use OpenEvidence, and they're not charging for it. So of course, when that comes out, we have to say, okay, if the app is free, who's the product? Well, we are. Physicians are the product in this situation. Our captured attention is what's leading to their large valuation. Whether they're going to sell our attention to pharma companies or they have some other business model planned, of course, I'm not privy to that. But at a $6 billion valuation, eventually the investors are going to want to be paid back for that and handsomely on their initial investment. And you don't really generate revenue by giving physicians free access to your app. So whether they decide to charge physicians in the future or whether they potentially use physicians' attention to sell ads to pharma or something to that effect remains to be seen. But at some point, again, like I said, there will be some cost associated with this app. Question number 3, will I get sued? Well, the legal framework associated with these apps are pretty straightforward. They are not touting to be any sort of medical decision maker. The liability fully rests on the physician that is using the app. Now, of course, I don't think any physicians are just copying and pasting their information from OpenEvidence into their chart notes, but we do have to be concerned about hallucinations that are associated with the output from any artificial intelligence, large language models, so that's something that you'll have to watch out for. When we talk about the legal framework, we have to talk about bias and incentives as well. In this situation, there's no evidence that OpenEvidence is biased by any pharma companies, even though pharma companies are potentially a revenue generator for them. As physicians, we have to be vigilant to ensure that these apps stay open and their information is clearly provided as to why they're choosing the studies they're choosing, which journals they're choosing, and for what reasons. We also have to be concerned with the fact that they're cherry-picking a select amount of journals. Those may be biased towards a specific region, like North America, and not have the appropriate representation from journals in Europe or Asia. And in addition, some of the journal articles may also be somewhat biased towards specific demographics and populations and leaving out other populations. So if every journal article in OpenEvidence is based out of North America, are we getting accurate representation for patients being treated in Africa or Asia? Those types of things have to be considered going forward. And again, it's upon physicians to stay vigilant to ensure that OpenEvidence is very clear about how their information is being disseminated. Question number 4, how does it fit into my practice? Well, from my standpoint, I do use the app quite regularly. It's not a daily use for me. I'm pretty confident. I'm about 10 years into practice, so a lot of the things that I see from day to day, I'm quite comfortable in knowing what the latest guidelines are. And honestly, I talk to my colleagues more than I use the app. I feel more confident discussing with my colleagues their experiences with specific clinical situations than I would querying the app. Now, in certain outlying situations, I think it is helpful to use the app in order to get a comprehensive review of what the research says. And so for that type of thing, when I'm seeing a patient with something a little bit more unique or rare, then I think it is somewhat helpful in that situation. The mobile experience associated with the app is really where it shines. You have it really at your fingertips wherever you are, and I think that makes a huge difference. You don't need to jump onto a computer and look up journal articles. You don't need to go reference in the textbook. I think that the mobile aspect and the immediate recall of information is probably one of the most important things associated with the app. I have a kind of a framework that I've been working on and looking at the use of AI for physicians going forward. Now, bear with me for a second because this is an orthopod talking about neurobiology, but in our brains we have the hindbrain, midbrain, forebrain, and the way I see physicians making decisions going forward using AI is the hindbrain being the complete recall associated with artificial intelligence. You don't need to remember studies. AI never gets tired. You can query it for whatever you need and it can collate all that information and keep it at your fingertips at all time. The midbrain is where you can kind of have an AI assist, where basically the AI can help you develop a differential diagnosis or help you with some different treatment options and that type of thing. And of course, you're making the decisions, but that midbrain layer is kind of where AI assists. And then the forebrain, or the decision-making level, is of course always up to the physician. That's where ethics are involved, that's where patient outliers are involved, and that's where really all the clinical decision is being made. And that's kind of how I see using AI in medical practice. I'm working on a video that I'm going to talk about that a little bit more in the future, because I think we as physicians are all kind of wrestling with, okay, how much should I use this? What is it really good for? And how can I use AI to help patient care? When I look at apps like OpenEvidence, there's so much hype in the lay public of how artificial intelligence is going to replace doctors. Of course, I don't see it that way. Textbooks didn't replace doctors. UpToDate didn't replace doctors. Google didn't replace doctors. And tools like OpenEvidence are not going to replace doctors anytime soon. It's a tool. We can use this tool to better care for our patients, and that's a good thing. In addition, it's a tool that saves us time, which means more time at home with our family and friends and away and outside of the office, and decreasing the cognitive load that is constantly on us and leading to some burnout issues associated with physicians. That's a good thing. That's where artificial intelligence shines in the medical community, is for us to use it as a tool to, again, make us practice smarter, not harder. I kind of see OpenEvidence as a really smart medical student that never tires, that is excellent at researching and presenting topics in a very easy, digestible way. And the nice thing is, when we look at it that way, we can use it as a tool to take some of the mental load away from us. Ultimately, you're the attending physician, you make the decisions, and you see the edge cases where the specific information that is brought to you by OpenEvidence doesn't necessarily work on the patient that you're taking care of. But that's okay. At least you have some baseline information that is readily available to you, really at the snap of your fingers. And I think that's a good thing for medicine going forward. So from my standpoint, is OpenEvidence an app you should download? Absolutely. You should have it on your phone if you're a physician. There's no doubt that it can be helpful for you in certain clinical situations. It is not the app that is going to make decisions for you. It is not the app that is going to take over patient care. It is a tool that you can use in your tool belt in order to help provide the best care for your patients. OpenEvidence does have some competitors out there. I recently reviewed the Doximity app, which has a DocsGPT, which is a very similar app to OpenEvidence. Also, I've linked to an excellent article by the Liminal MD, who compares DocsGPT to OpenEvidence and gives a really great breakdown of how these two apps differ. Please check that link out in the description and read his blog. It's excellent when it comes to artificial intelligence in medicine. I'd love to hear what your experience is with OpenEvidence or other AI GPT type assistants in your clinical practice. I think it's really helpful for those that are watching this video to read your comments below, because it gives them a better, bigger picture of kind of how different doctors are using these apps. If you have any tips or tricks that you use OpenEvidence for, please leave those in the comments as well. Since you're curious about OpenEvidence, you may want to check out my video up here about Doximity. It has a similar product, and I reviewed the Doximity app here. And over here, you'll see that I have reviewed an ambient clinical scribe. For those of you that are using ambient clinical scribes, you can check out this video as well. Thank you so much for watching. I know your time is valuable. I hope I provided some value for you today. Have a great day.